99,000 deaths happen in America each year due to hospital infections. Medical staff are supposed to keep surfaces sterile and prevent the spread of infection. Mistakes can be deadly. Understanding how microorganisms behave can raise awareness to false hygiene practices. HCAHPS has recorded the opinions of hospitals' overall cleanliness. By following proper cleaning techniques, we can hope to see an increase in ratings. The first step to understanding prevention is learning how bacteria thrives and populates. The Center for Disease Control, or CDC, states that transmission of infectious agents within the healthcare setting requires three elements: a source, a host, and a mode of transmission for the agent. They mention that sources may have active infections, maybe in the asymptomatic or incubation period, or may be chronically colonized with pathogenic microorganisms. Susceptible hosts are the recipients. Most of the factors that influence infection occurrence and severity of the disease are related to the host. The CDC noted, the outcome depends on age, underlying disease, and immune deficiency. Infections are passed in three different ways: contact, droplet, or airborne. Transmission through contact is the most common and can occur directly or indirectly. When you experience direct contact, gloves should be worn to prevent transmission. Indirect contact means the infection was spread using a vehicle or a third party. Colonized hands of healthcare workers greatly contribute to indirect transmission. This is why hand hygiene is so important. Droplet transmission, which is related to respiratory infections, can occur if you sneeze, if you cough, or talk. The CDC studies confirm that droplets travel an average of 3 feet from the patient. However, for certain viruses like smallpox, SARS, or COVID, droplets can travel at least 6 feet. Wearing masks and protective equipment can greatly reduce exposure. With airborne transmission, small infectious particles can survive over longer distances. Air currents move particles where they can become inhaled by people. Because airborne agents travel longer, they can transfer from individuals who didn't interact with the sick person. In this case, special ventilation systems are required to keep the building safe. A common example of an airborne disease is tuberculosis. Understanding how microorganisms spread can help hospitals control them. Medical staff should exercise correct cleaning techniques consistently. Nurses must never underestimate the power of good hand hygiene, as mentioned by the Nurse Journal organization. The Nurse Journal states the importance of properly following standard precautions, aseptic techniques, cleaning and disinfection, and strategies for prevention. According to the Clinical Procedures for Safer Patient Care by Doyle McCutcheon, hand hygiene is the most important part of practice for healthcare workers and is the single most effective way to stop the spread of infection. It also states that in order to break the chain of infection, that there are 5 key moments to perform hand hygiene. Key moment 1, before initial contact with the patient or environment. Key moment 2, before any clean or aseptic procedure. Key moment 3, after blood or bodily fluid exposure. Key moment 4, after contact with the patient. And key moment 5, after contact with the patient's environment. Doyle and McCutcheon warned that these methods aren't enough with certain risk factors. Jewelry, such as any rings or bracelets, cause hand washing to be less effective. Rings may tear or pierce gloves, making them non-sterile. If there are cuts or cracks on the skin, then bacteria can hide. Nail polish should be free of any chips or cracks. They also mentioned that artificial nails increase the viral load of bacteria up to 9 times. The length of natural nails should not extend past the finger, since most of the germs are found under the nail. The Hospital Consumer Assessment of Healthcare Providers and Systems states that their purpose is to enable consumers to easily assess their experience of care provided by the hospital. These star ratings are updated quarterly, keeping them current and relevant for consumers. They maintain reliability by holding statistics standards, thus requiring a hospital to hold at least 100 completed surveys each year to participate. The category that I want to focus on is cleanliness of hospital environment. The star rating for July of 2020 reviews the consumer opinions of 3,478 hospitals. Out of this total, 3 stars in this category held the highest percentage, which was 41%. Hospitals should strive to achieve 5 stars. It's concerning that only 7% of the reports rated their hospital a 5-star rating for cleanliness. Considering this high volume of bacteria that hospitals encounter daily, holding high standards of cleanliness is imperative. Precautionary methods and minimizing transmission are the safest way to prevent infection. After all, good hand hygiene is claimed to be the most important practice among medical staff. As a consumer, this means your health is literally in their hands. Thanks to HCAPS, opinions on medical care are more than just ratings. They stand for what we deserve, which is cleaner and healthier hospitals.